Hi, and welcome to a new episode of PawTube, a pause and read initiative focused on canine health and well-being. And today we have with us Dr. Carme Tordesillas-Olivar from the Veterinary Hospital in Dubai joining us. She is a specialist surgeon and she's currently pursuing a specialization in ophthalmology as well. And in today's episode, we will discuss some of the things that you need to bear in mind if you're caring for a visually impaired dog. A very warm welcome to PawTube, Dr. Carme. Thank you so much for joining me today.
Thank you. Thank you for the interview. I'm really happy to be here.
Such a pleasure. Dr. Carme, on to our conversation for today. I'm sure you've seen a lot of dogs who are visually impaired. Starting this conversation out with what you think are some of the common causes and symptoms that cause blindness in dogs.
Yeah, most of the time, blindness in dogs is caused by cataracts, which is quite typical that the lens keeps growing, but the back where it's held doesn't grow. So the compression makes this cataract appear, same as in humans. That hopefully is caught in time and you can do a surgery. We currently talking to some European diplomats, which is European and American diplomats, the highest specialism that you have, and never have been one in Dubai, and we're looking for them to come to do this surgery. So that would be good. Glaucoma is the other reason for blindness. The eye pressure goes very, very high, and if it's not controlled in time, the retina, which is the part of the back of the eye that makes you see, gets smashed, and then you cannot see. So cataract, glaucoma. Then you have another one called progressive retinal atrophy. That means that the retina, which is again the part that receives all the stimuli, the neurological part that takes it to the brain, starts degenerating. That is something that can start as early as 4 years or as late as 10, and it can take 3 months or 7 years. It's not very predictable, and there are some dogs more predisposed than others. Normally, this retinal atrophy happens at old age, to be honest, and they start with this atrophy, and you see the retina getting thinner and thinner. So they little by little they get blind. It's good because they keep adapting quite well. The other one is something called SARS. That is a sudden acquired retinal degeneration. So very, very fast the retina degenerates. And this one is a bit more painful to see because it's more typical of middle-aged dogs. Females are predisposed, and they are breeds like Dachshunds, the typical sausage dog, or Schnauzers, that they are predisposed to this. I think you can do a blood test to see if your dog might or might not have the predisposition for that. So yeah, basically these are the 4 bigger groups. Right. Other than that, you have trauma, typical road traffic accident that hits you in the head, whether it is retinal detachment on both eyes, which is very bad luck, or because of a impact in the back of your head, which it goes to the hospital, that is the area that all the information is sent, or because this impact, the retina detaches. These are less common because accidents, thank God, doesn't happen that often. So so you have all this that is very big names that hopefully you got a bit what it means. But cataract, which it has a solution, glaucoma that can be controlled time, and then the other 2 that they cannot do anything. It's just adaptation to life blind dog. About symptoms, it's quite interesting because when blindness is progressive, when it goes little by little, dogs adapt very well. And then you don't realize that your dog doesn't see until one day it bumps into something. Lots of times it starts with one eye when it's like a progressive atrophy, and they keep going okay. And then when the other one starts impairing is when something happens. My dog, for example, suffered from a similar this situation. He's 15. He was fine, and then a cataract started appearing. He was 15, he had died, didn't think much, and he's like, okay, let's see if we do the surgery. Then suddenly, he started being very scared at night, just at night. What happens? One eye had the cataract, and the other eye, the retina, started degenerating. the first time that happens is that they cannot see when the light is dim.
Yeah.
So obviously he was getting scared. You will switch on a light, fine. So the first thing that they generate is the part of the retina that sees that in the dark. Then is decided to do the surgery. I did the cataract. My dog is like, he's 15, looks like 8
altogether. Yeah.
Yeah, it was fantastic. It was like switching the lights on. So bumping into things, getting scared at night, or getting more wary, going slowly. These are the kind of things. Sometimes you will see a dog that is fine, and then he keeps bumping into one side. Maybe that eye is blind, but because the other one sees, you don't see it. But you can see that always bumps or something falls. You get treats from treats from the other, they don't see them. So that's for when blindness is just starting, which it would be great to spot early because glaucoma normally starts in one eye. So if you start seeing the dog will not take treats from one side, like from here, get suspicious. Let's get this checked.
Right. And from what I understand, a lot of these things are age related, and a few things are also driven by genetic predisposition, right?
Absolutely.
So if it's age related, then there are a few things that probably can be done. So how frequently would you suggest that dogs be brought in for, eye checkups to at least get to know the condition of the eyes? And for genetic dogs with visual impairment that is driven by their genetic predisposition, is there anything that can be done by humans?
Yes. First, terms of checkup, I think the annual checkup, when you go every year for the vaccination, it would be really good if they can include a full eye checkup. We do them here. I have a slit lamp. I check the tears because with age the tears go less as well, and some dogs they get a canine because it gets dark, the cornea. So a full checkup when your dog is fine once a year, that should be okay. When some disease is spotted, maybe you have to do it earlier. Maybe you have to do it every 6 months or every 3 months. If you have glaucoma, that has to be checked more often. First, you check it weekly or every 2 weeks until it is controlled. Once it's controlled, then you can do every 6 months. But yes, regular checkups, depending on what it is, once a year for sure. And then when there's a disease, we will tell. About what can we do, it's very difficult to prevent certain things. Cataracts, for example, there are studies that they say that the UV light from the sun predisposes to cataracts, particularly in dogs with light eyes, like huskies, for example. Is very well known that they have special goggles for dogs. They are very cute, by the way. And you can find it in Amazon. I've seen them. So you put, like sunscreens, and that is supposed to protect for cataracts. For glaucoma, there's no protection. That's something, keep an eye. But the others, not much. There are some studies that they say that beta-carotene that you find in carrots, is same as in humans, some protective effect in the retina and the neurology of the eye. So giving carrot as a snacks or having a diet that has beta-carotene, you will see it in the label. That if you are in raw diet, for example, shaving carrots or giving them as a treat, lots of dogs love them. So be my guest. I've never seen a rabbit with glasses. That's a joke. Sorry. So
yes.
You can see.
And would you suggest, I mean, let's say throughout their life span, would you suggest dogs to come in for checkups more frequently? I mean, younger dogs to come in more frequently than older dogs? How does it work, really?
I am a big believer that the family, the mom and dad of this dog or cat, will know if things are okay or not. There's common sense. One of the things that we do is we have a very active WhatsApp in PVH. To check up with us, to send a video, is this normal, is this not? So even if it looks normal and you're not sure, I'd rather you check with us and we will tell you, actually, come to us, or oh yeah, that's normal, or like for example, people get very worried because puppies, they don't blink at the beginning. When you do this, they don't blink because they still don't know what is fear and what is pain, so they are kind of like, oh, a hand. When they learn, they close. So it's not that they are blind, because some people tell, you used to do this to my dog and this puppy doesn't do it, my puppy is blind. No, it's just very, doesn't know that you can be hit. So I would suggest to ask every little thing. Send me of food, send me a photo of a reaction. That is okay. I'm so happy to receive these questions, because I want our cats, because our patients are our family. We want them to be the safest possible. So ask as much as you can, because we rather put you at ease or not, or tell you come. But yeah, I don't think puppies or oldies have to come more or less often. Some oldies, is true that maybe you have to watch them more, and sometimes twice a year I have to come for a small kidney check or for something. But we will tell you, I think once a year, if you are a responsible mom and dad that is looking, oh, is eating less or is vomiting more, we don't need more often, because you will know. As a routine, a dog once a year should be okay.
And look out for the signs. And whenever you get concerned about something, just reach out and ask your trust. And let's say you already have a visually impaired dog at home. What are some crucial steps to take to ensure that they are able to navigate life inside home and outside home properly and happily?
Yeah, actually, I was expecting something like this, so I wrote some of the things that I have in my handout. Because it's nice to know that dogs can see, know that, but the biggest of the senses. They don't rely on visual things as much as the smell, as the even the taste. When a dog sees, like if I come back from work, my dog will be like smelling and tasting. They get from so many senses that eyes are great, but it's not the main thing. So what you do is make sure that the other senses are stimulated. So I suggest that everybody of the household and every animal has a bell. If it can be a bell with different noise, is even better, because then they know that somebody's, they are not going to treat, they are not going to get scared, startled with that kind of things. Then train. Your dog becomes blind, teach them the words watch or something like this, or danger, and make them stop. That can save a life, because your dog is walking, doesn't see anything, and then a motorbike, something like that. Normally they will hear it, but imagine that, I don't know, it's a noisy day, and there's so many noises that doesn't. So watch for him to freeze. That will be great to teach. And the other thing is a step. When you're walking with your dog, you will walk with a short leash, and then you need to tell them all the steps, because otherwise this dog will trip, will get scared, like, I'm not going out again. And you want your dog to enjoy, you want your dog to do a normal life. So if you can have a close relationship with your dog, or everybody around him have this little and know him, then a short leash and let him around, smell like a normal dog. And some dogs, we had a dog that had bilateral glaucoma, really bad, ended up without eyes, but we put a prosthesis, so it looked like he had eyes. But the owners told me that thank God we did the surgery. That was with the specialist that they will come to Dubai to do these surgeries, because the dog is a different dog and is back to see better than before. And we were, there's no, it was the pain. We removed the pain, and the dog, because he knew the park, he knew his friends, he was 3 years old, he could hear. He was running, and they had a ball that had a noise. So they will throw this ball, and the dog will catch this ball.
Wow.
So you retrain them to follow the sounds of it. When you give them toys, they have to be toys with sound, and also things like kongs, that you have smelly things like, so they get other stimulations and other fun in life. One thing that is very useful when your dog becomes blind is, it sounds silly, but I think it's a very good. You go in your force, and then you walk around your house being in four legs and see all the dangers, like, oh, this is a spiky table, put a protection.
Okay.
Oh, this can fall in my dog's bed. Let's remove this. So you have to become your dog and see what is dangerous. Like if you had a toddler, because your dog cannot see if something is going to fall, if something is going to go into his eye. He cannot see, but he's... So
this
it
is
would be good to...
so practical. Yes, proofing the house.
Exactly. Yes. And then the other thing is, there's some people who has two dogs and one dog becomes the
guide
helper.
dog. Yeah.
You have to put them a little bit, but sometimes you can even put them a leash together, and it's quite beautiful when that is possible. There are some trainers that they will help you to do this, so they can be together running and doing things. But yeah, that's kind of the tips that I would suggest.
That's very comprehensive. Thank you so much. And my last question to you will be, if you can share even one first aid tip for humans with visually impaired dogs.
Yeah, that is all what most of the visually impaired dogs, the problems are falling things, falling in places, poking, run over. That's the typical ones. So I would suggest, whatever happens, like if something falls in them, first, if there's blood, control the hemorrhage, like put pressure. Have saline at home. Saline is always safe to spray, to clean, if anything like that. If it's a road traffic accident, the first you have to do is what I would do, because when you are hit, you can have a problem in the spine, you can have a head trauma. You don't want to move this dog much in case something is broken, because make it worse. Slide him into a towel, your t-shirt or your dress, whatever. Well, maybe not your dress in Dubai, but like something that you can slide. Then move the blanket out of danger and keep him immobilized. Put a car in the beds. That's the main. The is to avoid extra damage. If something falls in a dog's eye, saline, buster collar, contact the vets. If because they are blind, they might eat something that they shouldn't have eaten. Take a photo of whatever leftover is there and call us as well. Most of things are about stop what is happening, check the airways, check the bleedings, clean, and something that is good to have. It's good to have always saline at home and a buster collar. But buster collar is going to protect a wound. Saline is going to wound. Saline is safe for the eyes, and a buster collar is safe for not biting wounds and not scratching. I think this is very generally the thing that's
but very helpful nonetheless.
Thank you.
And thank you so much once again, Dr. Carme, for joining me today.